It depends a lot on what the type of incontinence is. So if it's stress incontinence, sometimes the treatments are a little bit different than if it's urge incontinence, but sometimes women will have both types. So we try to sort out what is giving them the most problem initially and then start with that one. So if it's stress incontinence, oftentimes learning to contract and strengthen the pelvic floor muscles will be helpful because that helps to close the urethra or the tube that the urine flows out of when there's that pressure on the bladder with stress incontinence that's causing the leak. If working with the pelvic floor muscle strengthening hasn't been enough, then sometimes a pessary can be helpful. A pessary is a medical device, a rubber device that just rests inside the vagina and it gives some support to the urethra, try to help prevent that leaking. And there's also surgical procedures that can put a little hammock or a sling, as we call it, underneath the urethra. In terms of the urge incontinence, also working to strengthen the pelvic floor muscles can be enough for many women. And as those muscles get stronger, we're able to actually teach them a procedure called urge suppression, where they learn to suppress that urge and give themselves time to get to the toilet before the leaking happens. If that's not enough for those women, we have medications that are available. And then we also have some procedures such as Botox injections in the bladder that help stop the bladder contractions associated with the leakage. And we also have a couple of procedures that are targeted towards what we call nerve remodulation, so that the nerve signals that help control bladder function begin to function a little more normally.